So to start with, the already we have covered other pointers in from fourth chapter. So that is Eastern therapy like Islam, Sufism, Zen, Buddhism. Then even a brief about yoga therapy. Also, we have discussed eclectic approach and all. Another point we have in the syllabus, that is group therapy. So most of the time they may ask this particular point for short note because eclectic and Eastern therapies are more chances to ask for broad questions. मग शॉर्ट नोट साठी काय उरतंय तर एक म्हणजे ग्रुप थेरपी किंवा मग प्ले डान्स म्युझिक आर्ट थेरपी अँड ऑल दोज थिंग्स. So group therapy, originally this particular concept has been in depth studied by Carl Roger. You can get n number of videos on YouTube where he himself is addressing the same. But originally it has been already used in so many other setups. Like for example, so with reference to alcohol addiction, rehabilitation and all, you must have come across the term called as AA, that is Alcoholic Anonymous, where they also practice the same concept called as group therapy. Group of individuals, they come together and they do interact, they do share their observations, experiences, or common suffering, even we can say. And one of the member is playing a role as a mediator. So with an intention that this particular discussion should be focused. It should not go haywire. From particular therapeutic perspective, the concept of group is usually from 8 to 10 or maximum 15 to 20 likewise. It is generally not exceeding, more than 40 or 50. Otherwise, मग ते mob म्हणून consider होतं. To have the effect, group has to be limited in size. Lesser the number, greater the effect, we can say. So group therapy, it has been used in addiction, rehabilitation purpose. For children also it is used. In some of the healthcare setup also, they have studied the effectiveness of group therapy. Like for example, I keep quoting the same reference as support group therapy for cancer patients. Nowadays, there are so many support groups for so many other psychological issues or challenges. In some of the Western countries, they have online support groups for trichotillomania, for eating disorder, for OCD, likewise. Upgraded versions पण आहेत, like online group therapy and all. But let's understand what exactly it is, how exactly it has been used or executed. In terms of REBT, which we have studied in third chapter, Albert Ellis himself has stated the importance, significance of group therapy. The book which is written by his colleague William Naus. In that particular book, as a preface, he has mentioned, in the process of developing and expanding RET theory and practice, I had many second, third, and fourth thoughts about the whole field of psychotherapy and about RET. But first of all, I applied it to group therapy around 1958 after Roger, and to marathon therapy around 1964, and discovered, see the next important point, Using REBT in group was in many ways more effective and beneficial than using it only in one-to-one encounters. Group therapy will give you quick results, and that too a long-lasting one, rather than having one-to-one particular therapy session. If you can guess any reason why it is so.
There is more relatability factor
Mhm.
in the group.
As in,
As in,
you
if
can explain.
I have something, experience something, so similarly, someone might have, or someone might have different, but emotions might be same.
Right.
So it might help because due to that.
Okay. Okay. Any other thought?
Like it can be of the peer relationship in
Mhm.
which like how peers support one another in boosting their self-esteem and self-worth
Yes.
as well.
Correct. Correct. Exactly. So what most important is that Akshata had said earlier, that is relatability. In a group, one can easily relate other story with self. Another perspective is when we are sharing our insights, our observations, or takeaway in a group. At the same time, we are also having the access to understand what others are understanding from the same group therapy interactions. So at a time, we are at advantage to have various perspectives, and that helps to bring the flexibility in our thought process, which is comparatively difficult to have in a one-to-one session. So, to understand in a nutshell, group therapy offers powerful, supportive environment. It is most important. So here we are going to understand that how exactly it has to be executed also. And there are some prerequisites to start the group therapy. It is not just like 10 or 15 people are coming together and started a chit chat. It is not just a simple discussion. It has been directed in a specific manner. It has been executed with some specific aims and objectives, where this powerful, supportive environment for growth, it is going to be addressed, where we are harnessing the collective wisdom and shared experiences, of course, which is also highlighting the importance of AA meeting. And so it turned out to be most effective in supportive to the core psychiatric treatment. Second thing is discovering how this particular therapeutic approach is fostering healing, enhancing social skills, and helping the individuals to navigate life's challenges altogether. So, any three of you can share some light on how group therapy is supporting or boosting social skills. How it is so? Akshada, Harsha madam, Amatullah. Any wide guess? How we can learn social skills with the help of group therapy?
So it starts with basic things. For example, the way of communication differs from person to person. So individual who might have problem in like have a confidence while talking, that individual can learn from someone else to how to speak and how to keep their points.
Correct.
So I would like to share one of the experiences.
Yes,
Like
please.
there is a series, Mismatched. So in that series, the person, like one individual is has due to accident has paralyzed his lower body, and he goes to therapy, denying it, but still he goes to it, and he joins group. And there are many people. For example, there is someone from depression, someone who had faced depression, and many relatable people. So through that, he learned how to be kind, because because he was paralyzed, he became more aggressive, and he started online gaming. So he had an image of a cool guy or something.
Mm-hmm.
So after that, he became very calm, and so the series is different, but this was one of the examples given
Okay.
in that. Yes.
Correct. Correct. Great. Life challenges, Amatullah. So because of group, how can we understand, how can we navigate life challenges?
It can be of conflict resolution,
Mhm.
like how we resolve certain conflicts. Problem solving thing starts within a group, and how it can be personalized as well. Like
Correct.
how a person, one person, उसकी क्या strategy है group, like problem solving के, and how we can apply it on ourselves as well.
Yes. One of the most important approach. So when we are discussing social skills and even life challenges, is most of the time it happens. So when we are tend to see from one single perspective to any challenge or problem, it becomes difficult to move ahead. On the contrary, if we are able to consider some other, couple of perceptions, perspectives, dimensions, if we are able to study some kind of case study in a group, there we are having some kind of brain stimulation, idea stimulation, thought provoking perspective we do get. So the more we interact with others, the more we are getting some broadened perspective to see the same stressful situation in some different manner. And that's why social skills and life challenges, it goes hand in hand. And both are effectively addressing in a group. So to execute, we need to understand some of the three core principles of group therapy. The first one is, if it is a group, it has to be shared experiences. It should not be the monotonous. If it is a group, it has to be addressed in a group manner. It should not be turned out to be one-way lecture method. Effective turn taking, it is also equally important because it is a group again. कोई एक बातें करेगा और फिर बाकी सुनेंगे, या फिर कोई सिर्फ सिलेक्टेड 2 3 4 लोग बोलेंगे और फिर बाकी लोग चुप बैठेंगे, it won't help. Second and most important thing is confidentiality. This is the most important principle. There are some support groups where girls who have been the victim of harassment, abuse, they do come together, they do share, they do ventilate, but their stories remain completely, confidential. Same principle we do follow in one-to-one counseling session. How you will discuss about the third one then? Mutual support as a principle of group therapy. Your thought?
Like so, sorry. Like you have just discussed about the abused one, abused group. So, how we can overcome that trauma by supporting each other.
Mhm.
That can be the principle of mutual support, which helps them in overcoming the trauma, that
Yes,
past experience.
correct, correct. Also, as we study the concept of comorbidity in psychopathology, exactly in the same manner, say for example, for stage fear, stage daring, or phobia purpose, even if a therapist is using behavior therapeutic approach, systematic desensitization technique approach, or purely REBT approach, in addition to that, if we ask the individual, the client, to participate in small group settings and practice to talk in front of group, then even if at initial level the same client person may make some mistakes, even at that time it is a role of other group members to respect and to accept the person, to motivate the same. In that case, his behavior, his confidence will grow like anything. So mutual support, it is important. The more we are able to follow, to practice these principles, the more we are able to reach and achieve the goals. As we can see, the emotional healing. When I'm able to ventilate my emotions, my core suffering with other few peoples, where I am also getting the experience of being non-judgmental from them. I can ventilate myself. I can express myself so that I can reduce my stress. So this emotional healing, it is important. Already we have discussed about improving coping skills, how exactly it is. In that AA, again, Alcoholic Anonymous group, in a group of 10 to 15 individuals, one by one, everyone is supposed to discuss how he has managed, how he has overcome his temptation or conditioning to get addicted to drink. That means if 15 individuals are going to share their experiences one by one in a group, that means one individual is getting other 14 perspective to cope up that temptation or the kick, as they say. How he has control, how another one has regulated his interest or kick, how the other one has controlled the same. Till the date example, I was only aware about emotional coping mechanisms. But when I got to know other five perspective, then I am able to aware and educate myself about problem focused coping skills. So the goal, it is going to be achieved now with the help of group therapy. And ultimately, it is helping to have personal growth as well. So this sharing, mutual respecting, it is most important in group therapy. These are the general, basic, superficial, means common three types of group therapy. Again, lecturing, it is totally different. But making them to interact, to share their experiences helps a lot. And that's why psycho-educational group therapy, it seems to be important to make them aware about their set of actions, about their behavioral pattern, likewise. It helps them to focus on teaching skills and providing information about specific conditions. So the next slide, it is about that same group therapy, which I have implemented in 3 schools of Nasik city as a part of my PhD intervention. In one of the school, an 8th standard guy, after having that particular session, he himself approached and said that he is getting addicted. He has been addicted to smoking addiction, herbal smoking, and even porn site addictions, being in 8th standard. And the reason he has approached for a session was, he said कि आज जिस तरीके से बातें सेशन में डिस्कस हुई, उससे पता चला, उससे मुझे ऐसे फील हुआ कि ये चीज मैंने आपसे डिस्कस करनी चाहिए. Educating the person, clients, from psychological perspective, type of group therapy. Second thing is interpersonal process, which emphasizes understanding and improving relationships through group interactions. Especially, it is most important or very easily get stimulated when you are able to effectively use transactional analysis model in a group setting. Like, for example, how we are using those strokes, the kind of psychological games which we play with others, and even the role play technique, which is a part of REBT. That helps the person to understand, to introspect, to reflect how exactly I am interacting in my daily life with ABC or XYZ person. Because I was able to practice this demo in a group setting, so it helped me to have self-reflection. Another type of group therapy. And third thing is about cognitive behavioral group therapy. If you can share your view, any guess about the third one?
Sir, as we mentioned in the principles about mutual support, so the cognitive triad of hopelessness, worthlessness, and helplessness. So in that feeling, the mutual support in the group therapy can help a lot to an individual.
Correct.
As well as there is a negative thought. So without actually addressing the thought, just by others speaking to them, the cognitive restructuring could start easily for an individual.
True.
Yes.
Right. Let's discuss now the benefits of group therapy or advantages. It helps us to have enhanced support. In brief, I would like to share that. So while having a course on 2 months counseling skills, I have come across rather 7 to 8 girls, they have shared their personal experiences, that how this particular group support had seems to be more effective to understand themselves. When we are in a group and when we are sharing some similar experiences, or when we are able to have some different perspective, most of the time from a same age person, then we tend to see the same situation, of course, in some different manner. And that helps to feel understood, even validated by friends who are going through the similar phase, challenges. Of course, new perspective. And third thing is it helps to have improved social skills, which otherwise we are not having any direct option or platform to practice our skill. Usually by practicing traditional systematic desensitization approach, it is so time consuming and it is so one way, typically mechanical approach. Instead of that, the more we practice in a group, the more we interact, it helps to have more effective emotional intelligence, how to understand others' emotions, how to perceive the same, how to recognize, how to observe, and how accordingly we can regulate our moods, our thoughts, ideas, content as well. And that's why this group therapy, it is most important. So automatically here, we are actually applying and understanding the crux of social psychology. To what extent my presence is affecting others' mindset, and to what extent others' presence is affecting my mindset. Group therapy is one of the most important representative approach in this case. Exactly who can benefit? Talking in terms of clinical psychology application, individuals who are suffering from anxiety, depression, grief, and even trauma. So when I was implementing the psychoeducation module in all the 3 schools, it so happened, of course, it was after immediate that lockdown period. In one of the school, 8th standard girl who has lost her mother in COVID. She was so vulnerable at that particular phase. And it was, of course, difficult for her grandmother and aunt to control or to calm down. But after around 4 months, her grandmother and that aunt, Maushi, as we say, they both have approached to that particular school and they have mentioned that this rational emotive education sessions had seems to be very, very effective to our daughter. Because now she is more in a position to calm down herself and even to accept the situation. However, I was not aware about this incidents. I was implementing RET or RE in a more neutral manner. But it was her takeaway that how this RBT principles we can apply to our personal life. So this group therapy is also applicable to grief as well. Of course, anxiety and depression, trauma. So one can easily able to understand now. Is that okay to move ahead?
Yes, sir.
Yes, sir.
Okay. The therapist role, as we are following the same point from Core's book, even if it is psychoanalytical approach, behavioristic approach, CBT, REBT, existential, as a part of therapy, we also need to understand what is the role of therapist while implementing group therapy. These are the 3 main dimensions, main role is supposed to follow to have the objectives covered or goals which we have discussed earlier, that is personal growth and coping skills and everything. The first thing is one should not be biased, but rather therapist's role is to facilitate, to support, to motivate, to channelize, to strengthen, to guide the discussions. And ensure that the discussion place atmosphere, of course, it is psychologically safe. So the term it is used as facilitator. Because as a layperson in a group discussion, it may happen. Some may comment in a very judgmental manner. We need to understand it is a group. Some of them can be very, very sensitive. Some of them can be very, very practical by nature. So we have to facilitate, we have to understand, and accordingly we need to adjust the discussion or the topic. And so immediately it moves to the second function role, that is mediator. We are not here to take a particular side or to be against from somebody's side. So that accordingly, all the members can feel that yes, this is the place where we can express ourselves. And this is the place where we have to accept, we need to accept, understand others also. So likewise, the mediator. So practically, we are also need to follow the duration, the theme of the group discussion, where we need to pay attention how far it is going in direction to achieve the goals. And the third thing is just be observer. Do not get biased with any one approach shared in the group, because it is a group therapy only. There are so many dynamics which are going to be evolved in a group discussion. To navigate all these things, we need to follow the communication and most important, support, conflict, and communication. Already we have discussed. The most important thing is trust. So the confidentiality part we have discussed earlier. This is the place where I am going to discuss my core feelings, my core understandings, and I know I can trust the group members and the group leader as well. That this sharing is not going to be used in any other different manner for any other different purpose. If you can remove the T from trust, meaning काय होतं त्याचं?
रस्ट म्हणजे ते जे याला गंज जे म्हणतो आपण तसं.
To erode.
Exactly. That's why this trust is important in any therapeutic process, be it individual or even in a group. At the same time, some limitations or challenges also we need to understand while using group therapy more effectively. The first one is conflict resolution. If we are dividing 10 to 12 people in two groups and asking them to share means 6 people are going to discuss that XYZ belief, it is a rational belief. They are going to prove the point. On the same note, other 6 individuals, they are going to discuss for a while that how far the same belief is irrational. The purpose is to have the brainstorming. And after some 15 to 20 minutes having the, enough interaction, we can ask the same groups to interchange their perspective and to continue the same discussion. This is more challenging. Sometimes in a group, conflict resolution may occur. Like for example, in addition to this particular example which I have just shared, another thing was in cancer support group, it is quite important to understand that yes, they do get emotionally healed, psychologically healed because they are getting support from others. That yes, I am not alone who is suffering from this issue. But by participating in such kind of groups, I am able to understand, I am able to see that yes, there are other people who are also suffering from the same. But at the same time, during the discussion, one may have the understanding that my cancer stage is second one. And the person with whom I'm interacting is in a third stage. So the interaction with this particular person may increase my anxiety because now I am getting aware that after a couple of months, I am going to face this particular physical challenges, this particular physical pain, which is unavoidable, unbearable. That may increase, that may raise the conflict for some people who are participating in a group. Some cancer patients, they may start sharing about their diet, about doctor's plan and all. And other patients, they may have totally different perspective for their diets. We need to address, and so the mediator role. Ethical considerations. In addition to confidentiality, we need to understand it is a group. That means individual differences, they are going to be there. In a group, one may come from this particular religion or cultural practices or with this particular belief. Another 2-3 people, they may have totally different cultural practices and beliefs against this. So being in a one environment under the one roof, how we are going to adjust, monitor these 4 or 5 different mindsets and disruptions, easy to understand. Some of the stories we can discuss, we can have the more detailed interaction, but at present due to time constraint, so just one which we have discussed, it was of course with coping with grief. But these some of the means what we can say, the testimonials can speak a lot. So what is your takeaway? What you have understood? How far it has been, it seems to be more effective to boost your psychological, confidence, your emotional health. So this guy is saying कि अब मुझे गुस्सा नहीं आता है, इतना नहीं आता जितना पहले आता था, because of this particular sessions. Other couple of people, they are saying that yes, application of such psychoeducation group therapy sessions has to be there with regular education. That Gauri was, she helped a lot in these sessions. Like this. And lastly, to conclude or to understand the gist of this, individuals tend to get positive experiences by participating effectively in a group therapy. They do get sense of belongingness. Altogether, it helps to achieve the therapeutic goals. So we also need to understand that how far the objectives of group therapy and the objectives which I am having in my mind, how far they are getting aligned with each other. Then we can discuss the same. Is that okay?
Yes, sir. Sir, even Ellis had group sessions during when he was growing up. So
Sorry?
this might also, Ellis also had group sessions
Yes,
when he was.
yes,
It
definitely.
might be because of that he did group therapy sessions or
Correct.
related activity to it.
Correct.
Sir, I had a doubt.
Yes, please ask.
Yeah, in the we had discussed I don't remember the topic, the facilitator, mediator, and observer. So how does mediator work in that? I didn't get that.
Okay, just a minute. Is it visible now?
Yes, sir. The therapist role.
To mediate, in the sense to monitor,
Okay.
one need to understand the objective of group therapy and need to pay attention equally effectively what exactly the discussion is going on in all the group members. If that particular discussion is really supportive to achieve the goal, then one can help to continue the discussion or one can stimulate as well. But by
Okay.
any chance, if one is able to observe, understand that out of 10, at least 2 people, they are somehow the other way disturbing the entire group. Or these 2 people, they are just propagating their own agenda to discuss.
Hmm.
Then it is the group therapist or that particular psychologist role is important. He comes in the picture. He should.
Okay. Yeah, I got it.
Yes.
Yes. Thank you, sir.
Sir. Any other query?
No, sir.
Other couple of points. So we will discuss even tomorrow as well at the same time. Is that okay to all of you?
Yes, sir.
Yes. Thank you so much. Thank you.
Thank you,
आज के
sir.
लिए इतना ही.
Thank you.
I will not trouble much.
No, sir, you are not. मी तर नोट्स काढून बसले होते.
हा.
पटकन आता कंप्लीट करा.
Yes. Okay, चालेल.
Thank
चलो,
you,
bye.
sir.
Good night. Good night.
Good night.
Bye, sir.
Bye.